Welcome very much to this interview. My name is Emilia Frigovic. I am psychiatric doctor and integrative medical doctor, and I have a very big honor today sitting here beside Dr. Simon Yu. Simon Yu, thank you so much. I am very proud and I appreciate so much your time that I can ask you questions here.
Okay,
Thanks.
Thank you for the invitation.
Thank you. I will explain just a few words about this interview, and I will say a few words about you, Simon. Well, a few words to my purpose. My intention as a psychiatrist, integrative medical doctor is to combine both sides, and I have a very big passion about learning from colleagues who have invented very great possibilities, technologies and new sides on chronic symptoms from the mental side, but also from the physical side, and that's why I love to interview them and to learn from them. Dr. Simon Yu is an extraordinary, genius mind medical doctor who developed a unique, fascinating method of diagnostic and treatment option based on the meridian system, which has a very admirable success in detecting underlying causes of chronic illnesses and symptoms. Dr. Yu combines internal medicine with integrative medicine. He has been practicing internal medicine for 35 years, integrative medicine for 25 years, and worked as medical director and physician, and has his own clinic in St. Louis, where I was able also to make a training. He served also as medical officer in the US Army Reserves for 25 years, retiring as full colonel. And Dr. Simon Yu, his approach is think differently. We must correct the underlying problems that cause our illnesses. By doing so, our bodies correct themselves and return to optimal health. And for this, Dr. Yu has invented a few strategies to diagnose parasite and dental underlying problems, and also intoxication of the environmental toxins we are used to live in. With his method, the AMA, the acupuncture meridian assessment, he says like battlefield acupuncture, and will explain us a little bit something to this method. Also, Dr. Yu has written 3 books, which I have 2 of them here. And the newest one is Accidental Cure 3, Ancient Intelligence is put here. And there is so much to say. I will just start now with my askings, but my first question would be to the text of this book, which is written here. Warning, your medical problems may not be what you think, what you have been told, or what has been diagnosed. So, Dr. Yu, how do you mean this?
Whatever the diagnosis they have, I'm trying to translate it into something tangible as a subtle energy field. For me, I use meridian system. So translating, if you have MS, Parkinson's, or cancer, or unexplainable problem, trying to make it tangible in actually frequency as a sound or like a musical scale. I use meridian system. So for human, it will be, I use violin with a 40 strings. I measure 40 meridian as a system. I inspect the violin, and I play the violin, and I tune the violin. So that's what I mean. If you do that, it doesn't matter whatever your diagnosis is. You may put one of the bad 2 sound, put them on some parasite medication, and cleansing, detox, especially heavy metal, environmental toxins. Then whatever your diagnosis, many times improve. And sometimes people go through the whole healing process. So that's what I meant by the diagnosis is not as important as you may think. What's the underlying problem? And one person may have a Parkinson's, another person have a mental illness, another person have a cancer, chronic fatigue, and fibromyalgia.
And so this is very interesting because it is a different method on looking at the same symptoms. Yes, and you have much experience in treating people with anti-parasitic medications, for example. So I would like to ask here a question which I hear often in my practices. Well, when we don't see parasites in the stool sample, then one has no parasites. So what do you think about that after your years of experience?
Right. First time I used was year 2001 when I was in the U.S. Army, part of my military mission to Bolivia. We treat everybody with parasite medication, parental palmoate, or mebendazole, one of the medications available that day for the supply. We treat about 10,000 people in less than 2-week period. And already getting some report the very next day they're passing parasite. And when I came back year 2001, I started using parasite medication. I was doing EAB, checking for meridian system. So let's say you have IBS, irritable bowel syndrome. Before I use natural parasite remedies like wormwood, black walnut, clove oil, with a good success. People with IBS goes away. But year 2001, when I came back, I started using same parasite medication I used in the U.S. Army, mebendazole and parental palmoate, either one or the other. Then people, now when the IBS gets better, they keep telling me about, my asthma went away, my breathing is better, my bronchiectasis is better, and now I don't have a bronchiectasis anymore. MS patients say my MS brain lesion disappears, cancer patient, cancer become more stable, chronic fatigue, fibromyalgia gets better, hip pain gets better, and now I can ski, put on parasite medication. I was thinking, how could that be possible? So this is where you have to observation and make some sense out of it. So we have a called deductive reasoning, inductive reasoning. So if you eat kind of rotten meat, you get sick. By the induction, the rotten meat has something to make me sick. And then you eat some kind of let's say, grass, and you get better, then, this is like another deductive reasoning. So say, if you eat like a wormwood, black walnut, your GI problem goes away. That's basic philosophical approach. Induction reasoning and deduction reasoning. Now there's a next one that is called abductive reasoning. That's now you get sick, so you eat rotten meat, got belly ache, and then now you give your parasite medication based on your large intestinal meridian. And not only the IBS goes away, asthma goes away. Didn't make any sense. MS brain lesion disappears. While schizophrenia, they get better, they respond better. Cancer patient gets better. That didn't make any sense. So you have to have a called abductive reasoning. Now you have to figure out why it is described in medical textbook and why they're getting better. That's one of the foundation of medical hypotheses. But if you look for parasite as a standard test, nothing shows. Yeah. So this is where the problem comes from. But that's the basis of what my writing is about. Something is happening, but I couldn't prove it, so I call it accidental cure. Does that make some sense?
Yeah.
The idea about deductive, inductive reasoning, and that is called abductive reasoning. Yeah.
So it is very admirable how you searched for these things and you connected spots, which when you are not open to this, you don't see it probably. Yes.
Probably not. I don't know.
Yeah, and so what do you think now? Which role may have parasites or maybe also dental problems, which you are searching into a lot on the chronic symptoms our society and the people suffer from, like chronic fatigue syndrome and allergies, immunology symptoms, mental disorders. What do you think about that? Which role do they play?
I think dental problem play as much as a hidden parasite problem. And dental itself is a very complex problem, including dental parasite. entamoeba, denticulum, or trichomonas, and sometimes there's a real parasite is hidden inside your jawbone. I have some evidence based on those biological dentists working with me. Real parasite in the cavity, in the jaw. Yeah.
Oh, wow. Wow.
And then they have a direct effects on your trigeminal nerve going to your brain stem. And the trigeminal nerve is one of the largest cranial nerve controlling your brain in conjunction with your gut, the vagus nerve. The two of those meridian systems, dental, trigeminal nerve, gut, vagus nerve, that regulates your brain. As a lot of what we call neurologic problem is actually coming from the gut and the dental problem.
So it is very, yes, a logical connection, how you explained. The traditional medicine does not see this systematic correlation, yes?
So I learned EAB, electroacupuncture, according to Dr. Voll from Germany. He'd been doing this since 1950s and 60s and very popular in 1970s. Now, I never met Dr. Voll, but I've been using it for 5 years. I was really frustrated because it takes too much time to do it. You have to learn how to use homeopathic principles. And I was about to drop out of EAB. And then I went to Bolivia, started using parasite medication. And everything balanced so quick, so fast, except dental point. Now we have narrowed it down to dental point. And allergy, immune system as an autoimmune problem. So now I will narrow it down by eliminating very quick, very fast with the parasite medication to rebalance the system. So after you do so many years, I have a 5-second rule. In 5 seconds, I can detect the dental problem.
Oh,
Because it takes only 5 seconds to do it. But it takes it 10 years to sort things out. But,
yes.
And the other one is, vagus nerve, that's the gut parasite problem, and allergy autoimmune problem.
What do you think, where does all the allergy problems come from and immunology problems?
So our immune system gets confused, especially with the parasite. Well, they're probably more advanced than we are, the parasite, as from different, or different consciousness, different frequencies, but not necessarily as a good frequency. So they're evolving with us, but at a more advanced form. But they're using us, and they're hidden. So we don't see it all the time, unless it's so obvious, but most of them are hidden. And this is where accidental using parasite medication, then problem started disappearing. But I was using prescribed medication. I'm an internist. I had a lot of trepidation with my training. We have to confirm there is a parasite problem by cell test, then we treat. But we hardly ever see confirmed cell test. So in America, we don't have a parasite problem until I came back from Bolivia using parasite medication, and so many problem disappears. Some people say they did pass parasite, but many people don't. But the asthma goes away. That's one of the most common observations, the asthma. So I'm thinking, wait a minute, lung has something to do with the large intestine. Going back to meridian system, large intestine and lung meridian is what we call paired meridian. When you think about it, parasites love to go through the lung. So they have a nocturnal cough, morning cough, phlegm, but they are usually clear phlegm. And those things goes away when you go through a parasite medication. So eventually I'll connect the dot.
Yeah.
But there's no proof.
But many people get better, and I saw it. There's so many patients, and this is so extraordinary to see.
So, once you see it, yes, yes. Why don't I use parasite medication,
Yeah. The special thing about the AMA and your treatment is also that you combine many different anti-parasitic medication, no? And also you combine it with medication for the metals which the people have. So which role do metals and environmental toxins have? And
so environmental toxin probably make you more vulnerable to have a parasite and fungal problem. So when I say parasite, also it's a spectrum, so I usually including fungal infection too. Because when you take care of the parasite, you have to go through the fungal, and you have to go through kind of a cycling, parasite, fungal. While you are doing it, your body starts dumping environmental toxins, heavy metals, but also pesticide, insecticide. I've seen some of those patients dumping massive amounts of environmental toxin, and then they go through the hair loss, and then they get their hair grow back. Yeah.
Yeah. What I find very interesting or impressive is also the thing that when I give antiparasitic medication, only one, for example, then the people many times have this Herxheimer reaction. No? But when you measure the violin points, like you explained, the meridian system, you find a perfect composition of medication, and the people don't suffer so much. So this is very impressive. How can you explain that?
So try and errors. In the beginning, about 30 some years ago, I used only one, like a parental palm oil or mebendazole. But then these people feel better, and they keep coming back. So I increased the dose, and then I used a different combination of different kinds. This took me 10 years. That's why I train physicians who can save 10 years of my try and errors, but if you know how to combine them. But I will never use the word perfect. There's no such thing as a perfect combination. You're taking care of one, there's another community of the parasite will rise, so you have to check it. A certain few months later, you check again, and again, you have to go deeper and deeper layer. So people expect one cycle, maybe 3 days, maybe 1 week, we're taking care of it, but no. People who's been sick for a long time may require 6 months, a year, or even more to go through that parasite cleansing, while they have to go through the detox.
Also, because you mentioned this detox process, you recommend many times the gallbladder flush and these things. So why is that important?
Because our liver process detoxifications, and we get overloaded, especially when you go through the parasite cleansing. Sometimes parasite will holding on to environmental toxin and heavy metals. Now liver have to process it. And so you have to go through the periodic purging. That's a gallbladder liver flush.
Very, very interesting. And also you mentioned that I want to come back to the dental problems, which also in your books you prescribed also. It is very important to solve this and not only to take medication, yes?
Right. I look at the whole body. If you look at the 40 meridian as a system, I can go through the parasite cleansing, and they usually feel better overall, except I still see dental problem. Only take me 5 seconds to look at it, to detect there's a problem. And allergy, immune system, that's where the autoimmune problem shows up. So unless you're taking care of those two as a part of as a whole system, people don't truly recover from the whole process of healing. It's like playing violin. When the peg is off, peg have to be replaced or fixed. But it's beyond my profession. And when you send to the dentist, many times they say, that looks fine, leave it alone, and nothing gets done.
Yes. And this is also my experience in the practice, know that many patients come and they say it is everything okay, and there is no problem about root canals which are filled with something. And for many people it is very disturbing to hear that these root canals maybe could be the cause of their chronic pain, of their fatigue and migraine, and I don't know, many things. Yes.
So layer and layer of the problem. So I've been writing about the parasite, and they're happy when I write for the prescribe for parasite medication. But when I talk about they have to put their bad 2, 3 or more, then they get very upset. And I wrote one of my articles is, God forbid toothless in Vienna. There's a people, highly sophisticated people, educated people. For them, losing the tooth is socially unacceptable. And one of the fast ways to losing patient is emphasizing about the dental to pull the tooth out, especially in front tooth. For a woman, forget it. It's almost nearly impossible. They like to have a beautiful teeth and die, then toothless, but they don't realize that they can wear simple partial denture. Nobody will know that you have a tooth that's been removed. You don't need root canals. You don't need implant. You can get what we call Maryland bridge, bonding bridge, and that's just as good as implant or root canal, and probably safer.
So implants you see also like not as so the best option.
Not as bad as root canal, but they go bad eventually. It's a foreign body, especially when they do very aggressive implant. They put 8, 12 implants in one visit, and put all those those like infected root canals, and some of them will go bad and become probably psychologically. Now they spend so much money with all the trauma going through the dental operation, they cannot handle it to undo what went wrong. So
yes, this is quite a problem.
it's almost an impossible situation unless they're highly motivated.
Yes. You explained very good this connection between what happens here is very nearby to the nervous system, yes, to the trigeminous nerve and the vagus and everything there in the brain. It's very logical when you say that, but on the other side, in the traditional medicine, it's not like so common, and it is very difficult not to explain and to make here a bridge. So thank you for sharing it and for making possible for us to learn from you, from your experience. I would like to ask you about mental disorders another time, because as a psychiatrist, I'm always interested in what might help these patients who suffer from chronic depression or anxiety, panic attacks, or cognitive impairment, memory loss, and all these things. How do you see here the relevance of dental and parasitic problems and fungal problems?
Again, I'm looking, let's say somebody comes in with a severe anxiety, depression, and whatever mental diagnosis they have. I'm just translating into meridian system. And if the gallbladder meridian showing up, liver meridian showing up, large intestinal meridian showing up, a lot of time I can balance with parasite medication to balance gallbladder meridian, liver meridian, and large intestinal meridian. And if you look at the literature, Chinese acupuncture meridian literature, there are certain emotion tied with the meridian system. Gallbladder, liver meridian associated with the anger. Well, there are certain kind of a migraine headache where it can be associated with so many psychological components to it. Well, obsession, compulsive obsession might be associated with the large intestinal meridian. So those problems many times improve. They are in compound with the heavy metals and whatever the problem is. It's not genetic disorder, it's environmental factors, including parasite. So I wrote a few articles on it. One of them is called Parasite and Mental Illness. And the other one is Parasite and Mind Control. I wrote another article about toxoplasmosis as a part of the behavioral problem. And then many articles about the parasite, how it affects, because it's not a separate problem. What controls our meridian system? So from my point of view, does brain control meridians? Or maybe the meridian control the brain? I think the meridian is maybe pre-existing the field we need to creation of who we are. And part of them are brain, heart, lung, etc. So if we can correct the meridian system through the parasite medication and dental problem, often mental problem goes away, heart problem goes away, cancer goes away because we support the immune system, and the IBS GI problem improve, and the many other problems start dissipating.
Wow.
So I don't know whether I'm saying it
Yes.
in the right sequence, but how you understand? Yeah.
This is really, really interesting. I have so many questions because of this. It is so impressive. Also, in the last years, you know that there came many studies that showed that inflammation processes in the body and the immune system, the dysregulation, is connected to depression and anxiety and all these things. But you discovered all these by trying it out and seeing it on the patients that it got better. No, so this is so interesting.
Question, do we need to use all those laboratory tests as a marker for inflammation, cytokine, IL-6, TNF? We can do it, but it doesn't always correlate, and people have to spend a lot of money doing the lab tests. And meridian system, you can only, once you have a device, you can measure those. High means it's inflammation, low means chronic degeneration. To balance, whole idea is to balance the system, tuning the violin, being harmonious in our living lifestyle that we live in.
Yeah. Thanks. And also, you also mentioned the parasites and mind control. So this is a very interesting topic, and I would like to ask you this: well, how, or is it possible that parasites can control our emotions, our behavior, our decisions, inclusive? Because this topic is a little bit irritating for many, I suppose. But do you think this is possible?
Oh, absolutely. So parasite is probably the most advanced life form evolving with us. And we're trying to keep up with parasite to survive from the parasite, not the other way around. Depends on how you look at it. So if you're craving for, I want that candy, the question is it you or perhaps a parasite controlling your mind to get the candy to feed the parasite? Just think about it that way. One of the probably most difficult one is in probably social relationship, the parasitic relationship. People can have a parasitic relationship as boyfriend, girlfriend, husband and wife, and financially we have a pharmaceutical company jacking up the price, outrageous amounts of price. 25, 30 years ago, Albendas or Mebendas, very inexpensive. Now they're charging over 1,000%, more. So, I mean, sometimes I get a phone call, it will cost me $7,000 to get my routine parasite medication, a fraction of the cost 25 years ago. So they have to get it from India or Mexico to get the medication. I didn't know how much they're raising the price until patients are calling me and complaining about that.
So this is a very interesting insight in the parasitical mechanisms of our world and of many systems. Yeah.
Right, so the behavior, sometimes I hear it could be children with ADD, ADHD, or relationship. People say, my kid is much more easier to deal with, or my husband is or my wife, their behavior change. They become more calmer, less demanding, or less manipulative, etc. Because you get rid of the parasite and part of the parasite controlling our mind, becoming less and less.
Yes, very, very, very interesting. Well, I can say I see this effect after antifungal medications very often than this craving for sugar stops. No, so I think many listeners maybe have experienced this effect. And when we imagine how many parasites there may be, so the effect may be very, very big.
So the hardest is a social parasite. This is a very important topic. We are evolving right now. I don't know what it is, but as a whole society is controlled by this entity of what I call elite parasite controlling us, the general public. That's even more difficult to manage than physical parasite. So there's a layer, you have to go through the process. So you do parasite cleansing. One of the hardest part, sometimes I use either Bible or Quran or Torah, depends on their religious background. Nothing sure, but people complain. They hold on to it, and I measure the meridian system and reveal information that I could never be able to do on my own.
Wow.
So,
Could you explain to us, yes, so this is a method of the interrogation, yes, which
yes.
you will learn also in the AMA. So how can the listeners imagine that? So why do you need this Quran or these things?
Not that they need it. Some people, no matter, I reach my level of using different parasite medication, different technique, still they say, I have something in me. I don't know what it is. And one of my experience was a patient came from Argentina. It's one of my articles. Mary from Argentina got colon cancer metastasis to the lung. And at that time, one of my patients at the same time from Arizona came. He's a big into Bible. And I didn't know what to do with Mary from Argentina. And fellow from Arizona is a Bible, I call him Bible man. He's believe in Bible, so I asked George, can you pray for her? Because he have always a Bible with him. And what I was seeing another patient, because I didn't know what to do with Mary, and I knocked on my door, and she coughed up the hunk of a mass, and that was like a part of the lung mass, and it came out. Ever since it was about 20 years ago, I have a Bible in my examining room. So if I don't know what to do with my patient, I give them a choice. You can have a Bible, Torah, Quran, and atheists. I use all three of them together. And sometimes I check and surprisingly pick up through the large intestinal meridian, and I wrote an article about parasite comparing as demon. Demon in terms of not physical demons, but that negative energy still, even after you get rid of the parasite, there's still residual effects of the negativity. You still have to get rid of it, the negative frequency.
Wow.
I keep trying, but not that I have 100% success. I keep trying.
But yes, but much success which we see. This is very, very impressive. Okay, so I asked you a lot of questions. It is so interesting what you show us and what we can learn. Well, this might be the next question. Where can practitioners learn from you? You give teachings all over the world, but if somebody who listens is interested in learn your method, where can he learn this?
The best thing is contact my clinic. I do training. The training I do is a 4-day training. I do twice a year. I come to Germany at least once, if not twice a year, training. So I do train physicians, but limited to physicians and dentists who can prescribe medication. I'm kind of biased in a way. I don't want layperson or medical assistant telling the doctor what to write for the prescribed medication. It's not acceptable for me. Doctor have to know. Physicians have to know how to apply this meridian assessment and be able to prescribe, but not the other way around. So I will not accept any practitioner who do not have a right to use prescribed medication.
Yeah. Okay. So we will let also a link down on this interview so that interested people can search it and get the website of your clinic and maybe come to a training or a course.
Right.
And in as our interview will be shown also in Austria and in Germany, so are there also practitioners who offer the AMA there?
Perhaps the most well-trained, totally indoors will be Dr. Artikel from Cologne. And I think he ever not practiced in Bonn. I think it's Bonn, right?
Yes, Bonn.
And maybe you.
Yeah. Well, I had the honor to learn it, and it is so impressive.
Yeah.
But you have to practice a lot until it is very exactly and good.
Right.
Yes, and I'm still learning. But Dr. Artikel Hemert, we will let also in the text box of this interview, so interested people can go there, and patients. Yes.
I may add Dr. Hanmer Ratsek, but he's too busy with so many other things. I don't know how much he does with the things I do, but he understands all those conceptual idea of things, why parasite dental is so important part of it.
Yeah. And could you do you have some message or some recommendation to people who hear your message and hear your extraordinary experience and they search for help because the traditional medicine does not offer these kind of things? So do you have something where they can maybe get information, or what should they do? People with chronic symptoms.
First, maybe read my book may help to open up their mind about what's going on, and try to contact with a physician who is willing to try parasite medication. But nowadays, more and more doctors are trying to try, but they often use one or two different combinations. Ideally, you should check all the meridian. What the muscle test is another way, kinesiology test. And people do it on their own hacking, and so many people get well, but then many people don't get well, so they need the professional help. I've seen many people, they try ivermectin, they try fenbendazole, they try niclosamide, but not enough or right combination. And cycling the whole process, you have to go through antifungal and dental detoxification. They all have to be done, but I think there are enough success hacking the system on their own. I don't say not to do it, but do it with a caution that it may possibly backfire. One of the major backfire is if you do not give the killing dose, the parasite will look for a place to hide, to go to the deepest tissue. That can be pancreas, liver, or it could be a brain, or whatever deep level they will hide. So that can be, sometimes it can backfire. So I have to keep that in mind.
Yeah, and so all this information help also to get to know it and to see it and to search there for helping things. So because you mentioned this, that they go to deeper layers, for example, in the pancreas. And we know also that anti-parasitic medication helps in cancer patients often.
Yeah.
Do you see here a connection?
All the time. I see that all the time. So, but it's a different combination for different kind of a cancer require different combination of parasite medication. Just giving blindly ivermectin and fenbendazole is very popular. And some of them get lucky and they're right about it and talk about it in social media and all about hype. But you have to use a different combination for different conditions. Cancer is a broad spectrum and require a different sequence you have to treat them.
Okay, so this is something we can learn from this interview. I think when somebody has this chronic symptoms, going to a good dentist, looking good here, is there some maybe amalgam, still we see that, and all this root canals, and then layer by layer see what is there also with environmental toxins, parasite, fungal, and searching also for a practitioner who can do kinesiology or AMA or such an other diagnostic method than the laboratory.
Right.
Yes.
I refer to a D3 Klingler autonomic response test as a means to use a parasite medication. That's one way to do it. And I just like to pointing out, just go to your biological dentist doesn't mean the job is done correctly. It's a terrible misunderstanding. Just because you use a biological dentist, many times they miss many hidden dental infections and dental problems. Because we're going to the subtle energy field beyond what the X-ray may show. So functional disturbance, not the X-ray, not cone beam CT scan.
Yeah.
You know.
You always say energy comes before it gets materialized, yes?
Yeah,
So
there's a structural problem, yeah.
yeah, yeah, and also I remember in your trainings hearing from patients who seem to be okay in the x-rays and the dentist told that there is nothing, but you measured always this point, and in the end of the story it came out that there was really some cyst or some pathology there.
Right.
Yes, so we should all train the AMA or method of diagnostic this energetic
Right, some way to confirm whether the dentist the job done right or not. Just don't take it accept it as it's done because I want to see a dentist. Doesn't mean necessarily it's done right.
Yeah, yeah, very, very interesting, and it shows how many layers there are. Simon, I thank you so much. There were so many interesting questions and answers from you, and I would like, before we come to the end, ask you one last question. What do you think? What would the world make a better place if you could decide?
You know, that's really a big question. Better place. But from medical point of view, from my observation, is that parasite is an epidemic problem, but not just a physical level parasitic relationship in social parasite, financial, emotional relationship at the spiritual level. So we have to be aware of that. Who is controlling us, you know? Yeah. And without the understanding, I don't think we'll all be in a perpetual war. They want us to be divided. So there's no good solution to it. I like everyone to be dewormed, you know, twice a year. You know, one of my slides is about anti-aging and longevity based on the horse. The average lifespan for the horse will be about 20 plus years, but now with the regular deworming and proper dental care and improving nutrition, they actually extend the lifespan to 40 plus years.
Wow.
Almost doubling the lifespan of the horse by regular deworming, proper dental care, and improving nutrition. So it's three things, not one thing. But maybe it will affect psychological and emotional level. That's what I'm more interested. By doing it, can it balance our emotional state and spiritual level?
Wow, this is very, very deep, interesting, and very wise from my point of view. And I find it so good that you tell this too, this spiritual and emotional component, which many times in the medical system is not seen. Yes, so thank you very much. We have many things, many impulses to think about from you, and thank you for your holistic side on so many layers of the world, of the body, and of the whole human being. Thank you very much. It was an honor. We let in this text box everything from website, from your institute, your clinic, and your courses down there, so the interested people can find you and also find your books, which I recommend a lot. Thank you so much, Simon.
Well, Emily, thank you for this invitation. It was a great pleasure talking to you. Yeah.